Okay, well, welcome back, Dr. Bronson. Thank you for, agreeing to come on again. The first episode we did together, we were discussing all the things surrounding TRT. And there was definitely a positive, feedback from that. So I wanted to get you back on again today, so we could dive in a little bit more into synthetic androgens and some things surrounding that, especially when it comes to bodybuilders.
Sure. Yeah, absolutely. My pleasure. Thanks for having me.
Of course. So, to get things started off, I wanted to ask you, what exactly is a synthetic androgen and how is that different from taking, just taking testosterone for TRT purposes?
Well, synthetic androgens are steroid hormones that mimic testosterone. So what happened is in the 1950s, actually in the 1930s, we discovered testosterone was discovered before that, but testosterone propionate was synthesized in the early part of the century and was given to people, obviously, with hypogonadism, but it was also given for a variety of other things like kidney disease, because kidney disease patients develop anemia. And so even like females with end stage renal disease who would develop profound low red blood cell counts as a result of the anemia were given testosterone propionate. And that was a problem because the doses you had to use were high enough that it would cause masculinizing side effects in women. So, cause like hair growth on their face, voice deepening, all the things that testosterone classically does in female bodybuilders. It wasn't ideal to
Uh,
do that in 60-year-old women with kidney failure. So, what happened is the pharmaceutical industry took testosterone and, in a variety of different ways, modified it so that it had less what are called androgenic effects, so less masculinizing effects, but still produced some of the same beneficial effects in the case of kidney disease, increasing, the red blood cell counts. So the first one that was really developed were the 19 nortestosterone derivatives. So that'd be things like nandrolone or decadurabolin.
okay.
And so what are synthetic androgens? They're basically just modified forms of testosterone or DHT, and they're designed to have preferentially anabolic effects. So effects that either build muscle or have some of the other beneficial effects of testosterone and DHT, but without the masculinizing effects or without as potent of the masculinization effects. So that's really what synthetic androgens are. Technically, testosterone, in the forms that you take it for TRT, cypionate, propionate, those are all technically synthetic androgens. So they're really just modified forms of steroid hormones that are produced in our body. Steroid hormones are basically, you have two different types of hormones in the body. There's peptide hormones and steroid hormones. Steroid hormones classically were thought to they affect your DNA. Okay, so they cause your cells to produce new proteins in different amounts. So in the case of testosterone and other steroids, they basically tell your cell to, for example, produce more contractile proteins or to suppress the production of proteins that suppress muscle building effects like myostatin. That's just one example. I mean, they do thousands of things, most of which we haven't even really figured out exactly how they, exert their effects.
Mhm.
But that's what synthetic androgens are. There's different classes of them, obviously, but those are chemistry details basically. In the case of testosterone, there's a lot of agents that have modified testosterone directly. So like equipoise is basically a modified form of testosterone. And then there are drugs that
Okay.
are modified forms of DHT. That would be, things like Winstrol, things like oxandrolone or Anavar. Um, yeah, that's pretty much. what they are.
Okay. No, that makes sense. I never knew that about equipoise. That's actually interesting. So that's good to know because I think a lot of people don't even know kind of like the history and the comparison between like how some of these can be related to each other. And they're not like always a drastic difference other than like kind of like the chemistry involved. Um,
Right.
but like kind of leading into my next question, which would be how dangerous are oral synthetic androgens compared to injectables when it comes to, overall health in regards to like the function of your organs?
Well, it depends on the specific agent. I mean, the older oral steroids were designed to be heavily metabolized in the liver. And so they couldn't be converted to bioactive forms unless they underwent significant what's called first pass metabolism. So obviously the liver toxicity of many, not all oral agents is higher than certain injectable agents because as you can imagine if you're injecting something directly, I mean you don't things don't go exactly through your digestive tract through the
Mhm.
portal venous system into the liver for metabolism detoxification. So that's a general statement though. In terms of the other organs, synthetic androgens appear based on all the research we have now to basically cause the key thing is they cause cardiovascular damage. So they damage your heart and they damage your blood vessels. It's looking like the primary way that they do that, there's two ways. They cause mitochondrial damage directly, and they also cause what's called oxidative stress. So testosterone, for example, a lot of people think of when they say think of testosterone, they think of androgen receptors. Okay, there's lots of talk about how do I increase my androgen receptor sensitivity or my androgen receptor density. And I mean, you probably heard people talk about stuff like that. Like,
100%.
and the problem with all androgens, testosterone and other steroids is they don't just act through androgen receptors. They also act on other receptors called non-classical androgen receptors or non-canonical receptors, and they also have direct effects inside the cell on DNA and on mitochondria. So mitochondria are the things inside cells that produce energy. You can think of them as engines. So androgens cause oxidative stress by increasing electron flow through mitochondria. That might not mean anything to a lot of people, but the effect of that is it produces things called free radicals or reactive oxygen species. These are molecules that have unpaired electrons. And so when you produce a lot of those in the cell, you can think of them kind of like if you run an engine too hot, and I've used this example before, and engineers have pointed out that it's not like technically correct, but people can think like when your engine is running really hot in your car, you can like older engines would produce sparks, right? So they get too hot, they produce sparks, and sparks are bad because they can ignite fuel lines and damage other components under the
Mhm.
hood, so to speak. That's why you have heat shields and spark catchers or whatever they call them. So, in a similar way, your mitochondria do the same thing. Now, like I said, the problem with that is if you accumulate lots of free radicals, you have to have something to neutralize those. Otherwise, these highly reactive molecules damage other parts of the cell because they're like I said, they have unpaired electrons. So they try to steal electrons from other things. That could be part of the cell membrane, that could be, other proteins. So they cause a lot of damage. And when that happens in your heart, specifically in your heart muscle cells, and if it happens in your endothelial cells, those are cells that line your blood vessels. What that can do if you do not have sufficient antioxidant defense, meaning you don't have systems in place to neutralize the free radicals that the androgens stimulate excess production of, what happens is you start to cause cell damage. And the issue with the heart is if you get lots of free radical production in the heart and you do not have an antioxidant defense to buffer that, eventually those cells start to die. And if enough cells start to die, that can cause problems because in the heart you have the heart muscle cells they have to be healthy enough to conduct electricity in a coordinated fashion. And so over time, as the cells get damaged and as they die, which is a slow and insidious process, what happens is your immune system comes in and tries to repair the damaged cells. You can't have a bunch of cellular debris sitting between healthy heart muscle cells. And so the immune system goes in, triggers inflammatory cascades that recycles all the damaged debris, and that can form scar tissue. So it results in remodeling of the matrix around the cells, and that can result in, collagen deposition. And basically, the long story short is it screws up the properties of the heart of the whole tissue to where electricity can't be conducted in a coordinated fashion. And so this is why you see bodybuilders die of heart and vascular causes. They die of strokes, they die of heart attacks, they die of arrhythmias, sudden cardiac death. A lot of them go to sleep and don't wake up. I mean, these are issues of electrical conduction. And over time, the longer you're on synthetic androgens, particularly if you use high doses of them for long periods of time, that causes it never gets repaired, it never gets sufficiently repaired. And you end up having heart muscle that can't appropriately conduct electricity. Then the other issue is when you have enough cells that die, you don't have enough heart muscle cells to appropriately contract the heart muscle itself. And so you develop what's called reduced ejection fraction. There's a certain percentage of blood that fills the lower chambers of the heart that has to be ejected with each beat. It's around, like 55 to 65%. You don't eject all the so blood circulates through the body, okay, goes through the lungs, goes into the left side of the heart, the left atrium, and then goes into the left ventricle. That's by far the most muscular part of the heart. Well, it goes into the right side of the heart, goes through the lungs, then goes to the left. Anyway, that's the details aren't super, super important. But you can imagine if you get a lot of damage in your left ventricle and you have a lot of those heart muscle cells that are dysfunctional, well, it can't contract, as strongly as it should. And so you develop essentially early forms of heart failure. The other issue is if when you cause out of control reactive oxygen species production in your blood vessels also don't contract and relax the way that they're supposed to. So, and that's another problem. That's another issue that leads to things like high blood pressure, which that puts more stress on your heart. And it also leads to just dysfunction where you can't relax and constrict your blood vessels appropriately in response to exercise and increased demand. And even when you're not exercising, when you're at rest, the blood vessels can spasm or they don't, fully relax. And that's been shown to increase the risk of sudden death as well. And there's complex ways that happens. So the number one thing that kills long-term steroid users is heart problems and blood vessel problems. And that's why you see the most common causes of death are strokes, sudden cardiac death, heart failure, and even heart attacks where they get occlusions in their coronary arteries. So those would be the blood vessels that supply the heart muscle itself. And synthetic androgens have been shown to accelerate plaque deposition. So yeah, I mean that's it in a nutshell. That doesn't mention all the other effects it has in the brain, or they have in the brain, and they have in other organ systems. They can damage the kidneys, they can damage the liver for sure, especially agents that are extensively metabolized by the liver. And
Mhm.
so, that's why you see some of them get kidney failure, some of them develop liver failure. But far and away, unfortunately, there's a lot of famous, influencers and doctors that, oh, I'm the steroid doctor or whatever, and they hardly ever talk about this stuff. It's just like, I mean, we have good research on synthetic, and I wouldn't say good research. It's not super extensive because, as you can imagine, these are mostly illegal substances. So
Yeah.
it's hard to get like good studies on them. But for example, there's a group out in Norway that they have like a very I don't know about if I'd say large, but certainly bigger than anything we have in the US, a team that's devoted to the study of anabolic steroids, and they've released a lot of papers on the different mechanisms and why, the epidemiologic research as far as, look at patients that use steroids long term and what they die of, and then they've taken that research a step further and tried to elucidate some of those mechanisms. And a lot of these guys just don't talk about it. I even heard
Yeah.
one, I won't mention any names, but one of them last year, I have a video on my TikTok channel where I reviewed his video. And he's telling people like the number one risk you have when you take steroids is that you can get liver damage. And that's just not true. I mean, by far the biggest risk to long-term steroid use is the damage that it causes your heart and your blood vessels. That's not the only thing.
Yeah.
That's not the only problem, but that's the main problem. So it's unfortunate that a lot of these influencers don't talk about that, but I try to stay as up to date on the research as possible. So um,
I I
yeah,
think I think another thing is that like you said, a lot of people, whether they're younger bodybuilders or influencers or whatever, like they tend to focus more on like, yeah, like livers, kidneys, that type of health focus. And they're saying like, oh, it'll impact these things. But a lot of people don't even mention like, the cardiovascular system, the heart health. But I see
hmm,
some guys will start to think and talk about those things once they get a bit older. You know what I mean? Like once they're kind of like
yep,
into their 30s, they've been, using um, some type of synthetic androgens for a few years, maybe longer. And then that's when they start to think about those things kind of more into their older years, I find. I feel like the younger crowd,
yep.
all they think about is like, oh, if my liver's good, my kidneys are good, that's all that matters. But, they're not thinking about the heart, which is literally the most important thing to think about above those things, because like you said, it kind of has a trickle effect where it's like if the heart's impacted, then the other, systems will get impacted as well.
Well, yeah, I mean, that's true. That's true. So, people ask me all the time, like, how do I keep myself safe using steroids? And the answer is there's no way to keep yourself 100% safe. I mean, they're dangerous. There's another study released last year, March of 2024, in the Journal of the American Medical Association that looked at the mortality risk of using synthetic androgens. And the average patient age was 27. And I can't remember how long the patients used it, but they compared basically relatively young people,
Yeah.
guys in their 20s, guys in their early 30s. And the group that used steroids compared to the group that didn't use steroids, in some cases, a lot of them didn't even exercise. They had like
Wow.
a three-time greater increase of in what's called all cause mortality. So they died of all causes earlier than the non-steroid group. And this was only with a 10-year follow-up. So that's really a short follow-up. To have a three times increased risk of mortality in that shorter period of time is very significant. I mean that mirrors like smoking, 40 years of smoking,
That's
in studies
crazy.
that look at older patients. Yeah. So they're not harmless. I mean, I think I told you last time, I don't have a moral issue with people using compounds. It's not about, good or bad. It's about just knowing what the risks are.
Hmm.
And there's too much on social media where it's like, oh, there are no risks. You'll be fine. It's just a cycle or whatever, or blast cruise. And we can
Yeah.
get into the details of that, but no, I mean they do have risks, and they tend to shorten your lifespan fairly significantly. That doesn't mean you can't do anything to mitigate the risk. You certainly can. We don't have good studies showing how well the things that you can do are to mitigate your risk, but there's no way to 100% just remove the risk. I mean, anytime you take testosterone, especially at doses that are above medical doses, which would be like 300 milligrams a week, cypionate, enanthate, propionate, roughly. I mean, that's a loose ceiling. Some people are going to have issues even taking that high of a dose. Some people probably, can tolerate even higher than that. We don't know. We just don't know what the ceiling effect is. But certainly if you're taking testosterone at higher doses than that, or any other synthetic androgens at any dose, yeah, you're going to cause oxidative stress in your cardiovascular system. And so, is that going to kill you right away? That is very unlikely to kill you the day after you start. But over time, it does do damage. So there's a cumulative effect to how long you use them. And people know this. I mean, especially the guys in the bodybuilding world, they know this. I mean, it's common knowledge. The longer you use them and the higher the doses you use, the more at risk you are. So the two big
Yeah.
things that you need to do, I think, there's only two things really that you can for sure do to potentially mitigate the risks. And that is number one, controlling your blood pressure, like very aggressively. And the second thing is controlling your lipids and obviously getting, routine blood work. But as I pointed out for the last 3 years, just having normal blood work is not, oh, I have normal blood work, everything's good. No, that's not true. Your blood work doesn't really tell you the extent of vascular damage you have. Your blood work doesn't tell you what your ejection fraction is. So that can be a major red herring for people when they just get in the comfort of, oh, my creatinine is normal and my liver enzymes are normal, so therefore everything's good. That's just not true. That's demonstrably false. And then there are
Yeah.
medical tests that you can do too. So I don't know if you want me to get into that, but
I think that
I
would
could.
be a good point to touch on is kind of like outside of just routine blood work, even with blood work itself, like, what should people actually be, checking on a regular basis with blood work and what additional, type of like medical testing should they do, on a certain basis to, go over an overall assessment to make sure that they, are covering those bases to make sure everything's as healthy as it can be, or if there is anything alarming that they should address, that they'll actually be able to see it. Because like obviously basic blood work isn't gonna, like you said, show everything they need to see. So what are those additional tests they should do and the frequency involved?
So the lowest hanging fruit for anabolic steroid risk reduction is regular blood work every 2 to 3 months. And
Yeah.
you have your kidney and liver function checked. And usually you want to obviously do this before you start any compound so you know what your baseline labs look like before you expose yourself to anything. That way you have something to compare it to. The lowest hanging fruit is obviously checking your red blood cell counts, since androgens, and testosterone can increase your red blood cell counts, or what's called your hematocrit. And the hematocrit would be the fraction of your blood that is red blood cells. So anytime that's about 55% or higher, you have increased what's called blood viscosity. It's not increased thickness of your blood. That's the myth that people keep perpetuating. It's increased viscosity. Viscosity is a measure of how smoothly, for a lack of a better term, a liquid flows through a medium. So in this case, through your blood vessels, and especially the smallest blood vessels in your body, your capillaries. The issue with that is you can develop blood clots when your viscosity gets too high, and blood clots can obviously kill you. If you get blood clots in your lower legs, that's usually where they start. Those migrate into your
So,
pulmonary circulation, can cause something called a PE, pulmonary embolism. So making sure your hematocrit is 55 or lower, and you check that usually, like I said, every 2 to 3 months. TRT patients really just need it every 3 months. And
mhm.
if that's too high, the only thing you can do to mitigate that is donating blood, getting phlebotomized, and to keep that lower. There's no supplement that lowers your hematocrit. All these supplements people advertise to lower hematocrit. They've never been shown to do that. And in fact, even if some supplement like hemoflow did lower your hematocrit, that would be extremely concerning, because the only way it could actually do that, it would be catastrophic. That would mean any number of things, that it causes your red blood cells to die early, or causes your spleen to sequester them more. I mean, it'd be catastrophic, or it causes bone marrow toxicity. So that wouldn't be a good thing. That would be disastrous if that happened. So that's the first thing, is your hematocrit. The second thing is your lipids. So the lowest hanging fruit there is your LDL cholesterol. That's what actually deposits in the arteries themselves. And like I said, steroids accelerate plaque deposition. So actually, steroid users cannot simply have normal LDL cholesterol. They actually have to have artificially suppressed LDL cholesterol, as suppressed as it possibly can be. So most people consider a normal LDL cholesterol to be under 100. I've recommended that people who use synthetic androgens long term, they need an LDL under 55. So in order to do that, you need medications, and you need to have it checked regularly. Um, so that's a low hanging fruit there. And because obviously we have studies, once your LDL is under 50, it's really, really, really difficult to actually deposit and increase your plaque burden in your coronary arteries. So, for example, patients with LDLs in the 30s and 40s, since we have medications that can lower it that much, they don't get myocardial infarctions.
Okay.
And so that's the other thing, is making sure that your LDL is under 55, under 50. And unfortunately, that's going to require medicines to do that. Statins, ezetimibe, bempedoic acid, potentially even injectable medicines like PCSK9 inhibitors. It's a drug called Repatha. And usually, you're going to need a doctor to help you with that too. I mean, so that's the second lowest hanging fruit. And then obviously your kidney function, your creatinine. Creatinine, it's used to measure something called GFR, glomerular filtration rate, which is the efficiency of how your blood is filtered through the glomerulus of the kidney, so the blood vessel system of the kidney. If the problem with creatinine is it can be elevated just because in patients that have a lot of muscle turnover.
Mhm.
And so there are guys that have a lot of muscle mass that have elevated creatinine, but they don't necessarily have kidney dysfunction. And there's tests you can do that are, that is not affected by protein turnover. One of those tests is called cystatin C. And making sure that's all normal before you start, and making sure as you're using the compounds that it doesn't go up. But creatinine is a good start, because, for example, if your creatinine is normal, let's say it's like 0.9,
Yeah.
but then you're taking steroids for 3 months, you get your labs checked, and now your creatinine is 1.8. That's a huge problem.
Yeah.
That's not good if that happens. So the trend is important too. And yeah, you can measure things like cystatin C, but the trend is important to pay attention to. The other thing is your liver enzymes. For compounds that are heavily metabolized in the liver, you can pretty much think anything you take orally. This is not universally true, but pretty much anything you take orally can cause liver damage. And so the big things you pay attention to is your liver enzymes, your ALT and AST. A normal ALT for a healthy adult male, ALT stands for alanine aminotransferase. That's a liver. It's not completely liver specific. It's found in other tissues, but primarily the liver. That would be anything that if your ALT goes from 30 to 120 after you've been on compounds, that's a big problem too.
Yeah.
So and also your platelets, your liver. The earliest sign of liver dysfunction that's really problematic is your platelets start to go down because the platelets are, there's a chemical called thrombopoietin produced in the liver that's heavily involved in platelet formation. So once you cause extensive liver damage, your plate by the time your platelets start to go down, you're in pretty big trouble. So that all that has to be normal too. That's as far as blood work goes. I don't recommend guys just monitor their blood work themselves. If you're not a medical professional, it's typically not a good idea to do that. It's better if you have a doctor that can do that for you. But that's
Yeah.
as far as blood work goes. Other tests that are important is blood pressure. I talked about how steroids damage your blood vessels and cause inflammation in your blood vessels. One of the ways that we can detect that is obviously if your blood pressure gets very high. So if you're
Mhm.
on compounds, you really want your blood pressure to be 120 over 80. And if it's consistently over that, 120 would be your systolic number, the top number, 80 would be the diastolic number, the bottom number. If either of those are consistently, over like the upper numbers over 130, the bottom numbers over 85 to 90, like consistently when you're at rest, you have the blood pressure cuff at the level of your heart and you're not anxious, you didn't just pound one of these. You want to make sure that it's under those levels, and if it's not, then you need medications to make sure that it's under that, because whatever androgens do to your vascular system in total is going to be greatly compounded if your blood pressure is out of control. So you need drugs like telmisartan, and
Mhm.
it doesn't necessarily have to be telmisartan. I think that's the best one, but you
Very
need
common.
that in, yeah, and you need other drugs if you're already at the highest dose of telmisartan, should be 80 milligrams a day. Um, if you can't get your blood pressure under control with just that, the next drug to jump to would be nebivolol, which is a beta blocker. But beta blockers aren't typically used for blood pressure, but in the case of nebivolol, it has special properties that protect endothelium from oxidative damage, and it can pretty efficiently lower your blood pressure too. So that's the key with the androgens, is making sure your blood pressure is not a little high, definitely not abnormally high, but it has to be normal to low normal. You can't walk around with blood pressure that's abnormally high, or it's going to greatly accelerate the damage to both your heart and your blood vessels and your other organs too, especially your kidneys. As far as the heart goes, before you start compounds, it's most ideal if you get what's called a transthoracic echocardiogram. That will be an ultrasound where you basically sit down on a table, takes 45 minutes to an hour, and they use an ultrasound probe to look at the structure of your heart and how well it contracts. It gives you something called a left ventricular ejection fraction. So you want to make sure that's normal. And then pretty much for like professional steroid users, I order echoes professional steroid users, bodybuilders, guys, or fake natties. All right.
Yeah.
So there's a lot of fake natties who tell everybody they're not on steroids, but they're honest with their doctors. I mean, because a lot of them understand their risks to being on the compounds. And so it's a good
Mhm.
idea to get that checked once a year. There was a study, December 2024, European Journal of Preventative Cardiology, that looked at long-term synthetic androgen users and how it affects their ejection fraction. Turns out that um, people that have used synthetic androgens, be it consistently or even just cycling them, okay, intermittently or blast cruising, whatever terms you want to use, they don't necessarily use high doses that entire 9-year period. but even just intermittently, 50% of those patients will develop reduced left ventricular ejection fraction. That's 50%. It's not 5%. It's not, you know, just, if you get really unlucky. No, it's a coin flip. There's a 50% chance you use steroids that long, whether it's continuous or intermittent, you will develop reduced left ventricular ejection fraction. The good news that came out of this study is there are specific tests, a specific type of echocardiogram you can get to detect these changes before your ejection fraction goes down. That's called an echocardiogram with speckle tracking that measures something called global longitudinal strain, or GLS. So patients that eventually go on to develop reduced ejection fraction, their GLS, I mean, that doesn't mean anything to average people, but let's just say there are parameters on that particular test that become abnormal before it affects how much blood your heart can pump out with each beat. So that's another key test. In fact, that's, I think, the number one key test that professionals who rely on the use of compounds for their livelihood, which professional bodybuilders do. I mean,
Mhm.
we have to be real about that. That's the kind of test that they need so that they can hopefully detect changes in their heart muscle before it causes what is oftentimes irreversible damage. So, and that's the other scary thing from this study too, because it wasn't just guys that were using steroids at the time that the study was conducted. There was even a huge percentage of guys that in some cases hadn't used steroids for 5 or 6 years. Still, about 40 to 50% of them had reduced ejection fraction. 10% of them had clinically diagnosable heart failure, what's called heart failure with reduced ejection fraction. So those guys, 10% of them are walking around with a significantly increased risk of sudden cardiac death. A lot of these guys, if they went to the hospital, they wouldn't leave they would leave the hospital with an implantable cardioverter defibrillator, so that if their heart goes into an abnormal rhythm or just stops, they can basically have a device that helps resuscitate them. That's pretty scary. That's just to give people an idea of, it's these aren't like benign things. You can do things that can help protect yourself, but with all the tests that I just said, I mean, a lot of these terms are going to not mean as much to people. The key thing is just to have a doctor that knows these things and is able to monitor these things. And it's not just your blood work. Your blood work is important, but that's not the only thing that you need to really maximally protect yourself.
No, and I think that's something people need to hear because, a lot of people just, like you said, they look at their blood work and they think everything's fine. But they haven't really dived into the additional tests, like you mentioned with the
Yeah.
ECG and things like that, which I think people don't really even think about. And it's kind of crazy to hear, like, what you said there. It's like a lot of people, have these underlying issues, have no idea. And then if they actually did go to get it checked out, they'd find out that, they're almost lucky to be alive in a sense after like years of, abusing certain substances.
Yeah.
Um, so yeah, it is like it's a crazy thing to hear it, but I think that's what people need to hear at the same time. So when it comes to, like surrounding like mental health, could you kind of explain how like synthetic androgens would have an impact on your mental health and dopamine and things like that?
Well, a lot of the how various compounds affect the brain. See, the thing with the heart and blood vessels, they all have similar mechanism of how they damage your heart and blood vessels. When it comes to the brain, this is where things get different depending on the compounds. And this is where there's hardly any studies. It's very, very difficult to get information on how the human brain is affected by illegal drugs of any kind, even ones that have been studied extensively, like heroin, cocaine.
Yeah.
There are millions of more studies on those types of illicit drugs than there are on steroids. So yeah, I mean, androgens can affect the brain, definitely. But the way that they affect the brain is going to be different from compound to compound, and a lot of those mechanisms haven't been fully elucidated, and a lot of it comes from rat studies. The key thing is androgens all affect something called neurite outgrowth, so they affect how neurons divide and how they basically partition certain parts of their components, and they affect things like microtubules. So they affect cell division, and then they affect mitochondria too. Remember, I said mitochondria; those are your cellular engines. So
Yeah.
they do cause oxidative stress in neurons, and how they affect someone's mental health is it's very difficult because they affect your brain volume. Definitely, there's studies, at least in rats, that show that various types of androgens affect how your brain volume and can affect brain development, especially. um, but as far as associations with mental health issues, the best we have are from epidemiologic studies. We know synthetic androgen users die of suicide more often. They have increased depression. They have increased risk of addiction to other substances and abuse of other substances. But as far as the specific mechanisms, we have precious little information. The one thing that we do know for sure is that if you're a male under the age of about 25, it's a problem to use synthetic androgens, even just testosterone, because of what I said. The How neurons divide and how various parts of the brain develop. I mean, we know that adult males don't have fully myelinated frontal lobes till about their mid 20s. And androgens will definitely interfere with that. And there are epidemiologic studies showing that younger steroid users end up with lower brain volumes when they get older if they use compounds when they're younger. But yeah, it's really hard to make a broad statement. It affects your dopamine in this specific way. It affects your reward pathways in this specific way. Clearly, they do, but um, we just have little information on it. The big thing is just try to not use them when you're a young person, if you can. Which we have an explosion in the in the use of androgens amongst young people in both the U.S. and Canada. Looks like what the research shows. So it's
Yeah.
becoming increasingly an issue, and then probably will continue to be an issue. you know and this is also where just guys online and in forums and stuff know that, oh, when I take tren, I feel different, I feel very good, you get euphoric effects, or you know I develop dysphoria where my mood is very low. I mean, there's certainly correlations with the use of different compounds with different mental health issues that people experience, but I try to just use what the research shows, and there's just so little on it. All we can say for sure is it definitely does affect definitely does affect the brain, and definitely there are associations with the use of steroids and mental health issues. I mean, that's all we can really say for sure.
Do you think there's like an age that you would recommend people to kind of avoid using synthetic androgens so that way they're not, you know,
Definitely under 25.
under
You don't
25?
want to. Yeah, under 25 you want to really avoid them as much as possible for
Okay.
brain reasons, but also other reasons. I mean, you want to avoid them when you're really young because it's not the toxicity of androgens is not just simply related to the doses that you use. It's also the duration that you use them.
Mhm.
This is actually the key problem with testosterone replacement therapy is even at medical doses used for medically appropriate reasons, we do not have super long-term studies on the safety of even TRT.
Yeah.
But using common sense, if you go on TRT when you're 20 and you're on it because it's a lifelong therapy, you're going to have a greater duration dependent risk than someone who starts it, say, in their 40s, because when you're 40, you have less life to live than when you're 20.
Mhm.
So the same thing applies to steroid research too. Um, so avoiding it when you're young. Steroids are one of the things where, we get this idea. If I'm going to abuse drugs, I'm going to do it when I'm really young and when my organs are really healthy. With steroids, it's actually not good to use them when when you're young. It's the two choices are using them when I'm 20 or using them when I'm 30 or 35. It's going to be better. It's not good either way, obviously. It's better to use them when you're older, not when you're younger, for the two reasons I said: the brain development issue and the duration dependent risk issue. So the dose independent risk issue.
Okay. So
So,
I'm
but
making,
just to drive that point home. So in that study, I said 9 years of steroid use, 50% of those guys develop abnormal the ejection fraction. There are guys in that study that used very low doses of primo and testosterone for that period of time. There were guys that used very high doses of tren, anadrol, everything you could, the kitchen sink. So it was a mixture. And in that sample mixture, even the guys that were using low doses, they were still at risk. So there's a certain risk associated with androgens that is dose independent, if that makes sense.
no, it definitely makes sense because yeah, like someone like you're basically saying like the impact of what they're taking is going to make a difference more so because yeah, if someone's using a low dose of TRT versus someone blasting high amounts of like things like tren, like the difference on what's going to happen to them, I think even like brain development wise and psychologically and things like that is
Yeah.
going to be far superior.
Hmm.
Because I know that's actually one that I would find interesting. There probably isn't really too many studies on people that use tren, but I would say because that one
Not
is
almost
probably
none,
yeah,
pretty
that's
much
probably the
none.
one that impacts people the most when it comes to the psychological impacts, and I think it's something that
Yeah, I agree.
um, would be interesting to see a study, to see what happens to somebody long term because of that. Because even if you just used it, like you said, in your 20s or whatever, like you used it a few times, but then, what are the impacts of that 10 years down the road, 20 years down the road, and so on, just because it's interesting. It's one of those things where like I get it all the time. I get people that DM me asking me about trend and all these like, hot topic type steroids that they want to try and take and they know
Yeah.
nothing about it other than, oh, I'll get amazing results. But I don't think any of these people even consider, what is this actually going to do to me long term? And it's unfortunate that they don't even have something they can, look at like research studies that kind of like would deter them from, even dabbling in it because, I think that would be something essential to have happen in the upcoming, years is like having more research done on some of these compounds so that people can understand thoroughly, like, this is what you should avoid. These ones are safer, but not really safe. And then, this dosing range is more ideal than, just taking everything in the kitchen sink.
Yeah, I agree. I wish we could get studies like that, but they're really hard to do. Um, really hard to do. The best we
Yeah.
have with, I mean, we have studies with like Anavar, we have studies with Nandrolone. I mean, we have lots of Anavar studies come from people with like burns, and a lot of them are in like children. There's almost no studies that look at people using them for aesthetic slash cosmetic purposes, but it would be nice to have those since, especially because the um, incidence of anabolic steroid use is increasing over time. It's not decreasing, it's increasing.
Yeah.
So yeah, it would be
Um,
nice to have that, but there's many problems why it's very difficult to do that. Um, like I said, we still don't even have long-term studies with just TRT, like super long-term. The best we have is just a few years of like gel testosterone in older guys.
Hmm.
That's it. That's it. I mean,
That's
so
crazy.
yeah, there's huge gaps in our understanding. This is why, even TRT, you need to go to an expert. A lot of these TRT clinics are not good, and they don't have providers that have a sophisticated understanding of risks. And especially if you, like what I say, I have a few patients that are, um, it's a relatively small community of the people that are the most elite. So let's just say I have a few patients that they have to be on synthetic androgens because that's how they make a living.
Yeah.
I mean, that's just, they have to be. So, what I just, what I told you about the tests and stuff, that those are tests that I do on them.
Hmm.
But I tell them, all these tests are still not going to make it safe. It like really the purpose of the test, especially when you're talking about specialized echocardiograms, which would cost thousands of dollars to get out of pocket, at least here in the United States. These are not tests to say, oh, everything's good, your doses are great, and you're healthy and you're fine. The test is to see, are you starting to do damage to your heart to where you just need to quit, like you need to retire. That's the best
Yeah.
we can do for people. And obviously then we prescribe them medication. We don't prescribe them any synthetic androgens, obviously, but we give them blood pressure drugs, lipid drugs, other things, and check their blood work and stuff. So it's a risk reduction type of thing. It's not a I'm getting steroids from my doctor type of thing. No, it's just I'm going to someone who understands better than at least other doctors do the long-term risks and what to look for and how to best mitigate those risks. Because if I'm a patient and I make a living and I need to use steroids to make a living, like I'm a fake Instagram natty or whatever, well, if I need to make a living, I'm going to do it regardless of whether I have a doctor or not. I mean, it's just I got to feed
Yeah.
my kids, but it's just how it is. So, but if I could have a doctor that he may not be giving me the compounds, but at least knows what to look for, well, that's the best I can do. So that's what I'll do. A lot of guys aren't going to go to a doctor. I mean, they may have a
No.
primary care doctor, but their primary care doctor is not going to know a lot of the stuff I said. That's why I try to, that's part of my social media is to educate healthcare providers. I've had to document the primary care of men with non-medical, with complex non-medical androgen use history, where I list all these tests and the references and stuff. But um, obviously, I'm pretty unknown at this point, so I don't know that it's helped anyone really yet. But I do get from time to time referrals from other doctors and even internationally that ask me what tests do I need to do and stuff like that. So I am helping people here and there. It's just like the average guy who uses steroids, doesn't make a living off of it, may not have a money to for all these medical professionals and tests. I try to just give them the best advice I can, which is, at least know the risks and make sure your blood pressure is normal, make sure your lipids are really low. But
Yeah.
by no means does that mean that, oh, now you're safe. I'm on telmisartan now. I'm there's nothing to worry about. Um, it just doesn't work that way.
No, I think honestly, like even for where I am in Canada comparatively, I think there's not a lot of doctors around that are actually even able or willing or knowledgeable in this area when it comes to utilizing like synthetic androgens and stuff like that in bodybuilders. I know from my own experience when I was competing, I'd go to get my blood work done and like with a general practitioner, and they would just, no matter what it said, if anything was out of normal range, they're just telling you, you need to do this test, you need to stop doing this, blah, blah, blah. Like they're not really
Yeah.
doing anything productive for you. So I ended up just having to outsource. There's a website available where you can get blood work done, and there's doctors where you pay a fee, and they'll actually help you
Yeah.
if you're a bodybuilder or using TRT, etc. So they understand, certain elevations can be a little more normal, like creatinine if you're a very muscular person, etc. So I found
Hmm.
that more useful,
Yeah.
when it came to like dealing with the doctor than general practitioners. And just from like, your conversations with you, like I feel like I've, definitely learned more insights from you, and I would be more trusting with someone like you than any of these other doctors I've ever talked to, because you could actually, explain and understand like what bodybuilders are doing, not just because it's like, what they're doing. It's like, oh, you shouldn't do that because it's bad for your health. It's like, okay, people do a lot of things that are bad for their health, but like they're doing this to make a
Yeah.
living. It's like people smoke, they drink, they do other drugs that have really nothing to do with what they do for a living necessarily. They just do it because like it's a habit. So I think, having someone that kind of understands that that's their, their livelihood involved, and they're not just doing it for fun, is good, because then you're getting the proper direction that you would need. And that kind of leads into like the next question I was going to ask is like, for someone who is, whether they're a professional bodybuilder, an influencer, etc., if they're taking the approach of like, they're doing a cycle or doing like the, quote unquote, doing a blast and then going down to like TRT in between, what would you be your opinion on someone that does that? Like, is that something that, you would kind of approach with someone in that realm, or would you do it kind of differently?
Yeah. So I have patients on steroids that cycle, or the what they call it blast cruise, which I don't like those
Yeah,
terms, but
I don't either.
yeah, the idea is, yeah, they use for a period of weeks, 12, 16, whatever weeks, they use high doses of testosterone plus synthetic androgens. And then once that cycle's over, they go off everything except testosterone at a medical dose.
Mhm.
And there's a few things about that. Number one, that is, I have to say, it's best if you don't use synthetic androgens or use testosterone for non-medical purposes. That's the preamble you have to say. But if you are going to do it, yes, that's the correct way to do it. Is you don't want to, you want to have periods where you interspace the high dose usage with no use of anything other than testosterone at medical doses. So in other words, yeah, you want to go back down to TRT. That is a good thing to do, but you have to just understand that what accompanies that is not just, oh, I get off the steroids and lower my testosterone dose. You want to make sure that you try to minimize, especially the use of like aromatase inhibitors. So when you're on TRT doses, you do not want to be on AIs at all, period, at all. And even, I mean, we could get into this as a separate topic, even, but even when AIs do not protect you from anything. They actually compound the damage of androgens on your heart and blood vessels. And the higher the doses you use, the more damage AIs actually do to your heart and blood vessels. So guys look at AIs as, oh, this is a way that I'm going to mitigate side effects. That could be a whole other 2, 3 hour long discussion. The problem with that is, I talked about antioxidant defense in your heart and blood vessels. Your body has a designed antioxidant defense for testosterone, and it's called aromatization. Estradiol's one of its main purposes is to serve as an antioxidant for what testosterone does to your heart and your blood vessels. And I have lots of videos on that where I've explained that in great detail. And that's only been discovered in the last 5 or 6 years. So very, very few people even know about that. None of these steroid doctors with millions of followers have ever talked about it. They still think AIs are just fine. But I mean, now we know for sure that the AIs actually compound the cardiovascular damage and toxicity of androgens. So that's the other thing, is you want to try to minimize the use of other, even other medications and stuff. It's not, oh, I need my testosterone levels can be through the roof, but all my other hormone levels have to be in the normal range. That's not the right way to think about it. That's the way to think about it if you want to be in a box early. You want to use the least amount of medications to normalize numbers that are not as important as possible. Numbers that are important is your blood pressure, your LDL cholesterol, your kidney function, your liver function, your platelets, not your estradiol number. That having a high estradiol, especially if your testosterone is through the roof, that's not what's going to shorten your life. What's going to shorten your life is you taking a bunch of stuff to further um, attenuate the damage that the androgens do to all your other organ systems. And the best way to do that is with AIs. I mean, there's lots of talk these days about why we have some epidemiologic evidence that actually bodybuilders and professional steroid users die much younger today than they did, say, in the 60s and 70s. And I think, based on the research and the synthesis that I've done, a really big key reason, perhaps the number one reason for that, is aromatase inhibitors, or AIs have been around since the 90s because they were developed for the treatment of estrogen receptor positive breast cancer. They were never designed to lower estrogen levels in men. They were never designed for that purpose. But I think that's played a big role. And if people want to know more about that, I have interviews where I discuss that and stuff on my TikTok channel, especially, where I explain all that. But back to your question about blasting and cruising, yeah, the longer you can go on just medical doses of testosterone, the better. Now, the other thing is, people think that, oh, I'm going to blast and I'm just going to stop everything. Well, if you're using steroids for a long or even an intermediate period of time, you're going to cause hypogonadism. You're going to shut down your endogenous production of testosterone. So it's not necessarily the healthiest thing to just withdraw all compounds and be on nothing. This is where, having a doctor that can actually check your levels, see, how you're affected by the cycles that you're on, and put you on an appropriate dose of testosterone because hypogonadism itself can cause problems. I mean, most immediately you'll feel like shit. And then
Yeah.
there are going to be guys that watch this that they know that for a fact because they've tried to go off high doses of, you know, whatever their compounds are taking, a gram of testosterone, going from a gram a week of test, even 500 milligrams a week, even if you just do it for 16 weeks to nothing, you're going to feel not good. So, but also there's other issues just with having profoundly low testosterone levels, sexual dysfunction, and other things. So going to just medical doses of testosterone, I think, is by far and away the best thing to do if you're one of these people that is going to intermittently be on, high doses of androgens. And, like I said, making sure you keep monitoring your blood pressure, keep getting echocardiograms. I mean, I already explained, your risk from the compounds doesn't end when you stop using the compounds. We have studies now that show even former users, 5, 6, 7 years after they stop, they still have roughly equal percentage of them still develop reduced ejection fraction. I mean, like, it's slightly, obviously going off the compounds is better for you long term, right? But there's still, your risks don't end when you just stop them. Oh, I stopped them, so now I'm fine. No, you need monitoring. I mean, it's just that simple. And your blood pressure can remain elevated too. Another thing I didn't mention is one thing that I discovered about a year and a half ago that was completely ignored was that a lot of synthetic androgens cause nocturnal hypertension. So there were guys that patients I had, and I put some case reports on social media, where their blood pressure is totally normal during the day, but when they go to sleep, it can be astronomical, and we don't know why that is, but that appears to be an issue. So that's why a lot of times you need tests that can measure your blood pressure even at night. So it's not just, oh, my blood pressure's, when I check it once a week in the middle of the afternoon, it's fine. The thing I've seen it most commonly with is nandrolone. I've had at this point 3 patients
Yeah.
that normal blood pressure during the day, profoundly elevated blood pressure in the middle of the night, and that's a huge problem. So those patients have now been treated. They take blood pressure medications at night, and we at least mitigated that particular issue, but that's something people have to be aware of. So I mean, it's a good idea, especially if you make a living off this, to have a professional. This is not like a lay person's. I can just go ask a bunch of Reddit professors, who all think they're doctors, how to do it.
Yeah.
I mean, it's very complex, and you don't want to go it alone if you can, get professional help. But like I said, we live in reality. A lot of guys are going to use steroids without doctors, and they're going to get their own blood
Of
tests and
course.
stuff. So it's just the way that it is. We have to live in reality, not fiction. Unfortunately, like you said, a lot of people can't get good medical care because that is the attitude of mainstream medicine. Oh, you're on steroids? Well, just get off the steroids. Just stop using them. Oh, you're not going to stop using them? Well, I won't see you anymore. Or
Yeah.
I'll just ignore it. Or, I'll send you to an endocrinologist who will ignore it. I mean, I think that we do a great disservice to men in the Western world when we rub off, or brush off the fact that they use steroids. Because, for example, we don't do that with patients that abuse heroin. There are all kinds of programs and services and even medications you can use in patients that are addicted to opioids. And so we no longer, at least the mainstream opinion is like, we don't brush those patients off and just tell them to fuck off, because we know a lot of those people, if without help, are going to keep abusing the compounds, keep doing damage. We have like mitigation strategies. We have mitigation strategies for people that abuse methamphetamines, for people that abuse alcohol. When it comes to steroids, the attitude is just, you use steroids, okay, fuck off, go die.
Pretty much. Yeah.
I mean, it's not that doctors, oh, I hate you because you use steroids and I want you to die from it. It's just there's no research, they don't know what to do about it, there's nobody talking about it. All the major doctors that are influencers in the steroid space, they don't talk about any of the things that are important. They just make viral videos where, oh, this is oxandrolone and this is its chemical structure. And here's a bunch of bro science that I'm rewording in a
Yeah.
more technical fashion to make it sound smart. And this is what it'll do. A lot of that stuff is just nonsense. None of that stuff is based on any research. I'm pretty open about the fact that if you come to me, I'm not an expert on, you're a bodybuilder, you need to do a cycle of this at this dose, and like, that's not my area of expertise. I have no ability to advise people on doses of illegal drugs and what they could take, and you'll get this results from this, and you'll get, like, I'm not I would not be the right person to ask. I have no idea about specific dosages for specific aesthetic effects. I don't, and I'm open about that. Unfortunately, a lot of these influencers, even ones with medical degrees, put out there, oh, well, I'm the steroid expert, but somehow they don't know anything about any of the studies on risk reduction. A lot of them are totally clueless. And how do I know that? I've talked to a lot of them. I've
Mhm.
shared a lot of this information with them for the first time, but yet, you know, um, they just want to keep getting eyes on their social media channels and sounding like, well, this is a guy with credibility because he has a medical degree, but is he telling me any of the stuff that I talked about ejection fraction, about nocturnal hypertension, about the specific medications you need to use? They rarely talk about that type of stuff, which I think is sad. Um, I also try to just be realistic with people. I don't have moral judgments against guys that use steroids. It doesn't, like, I'm very libertarian about it. If you want to use steroid, like, I get it. You have to make a living, you got to use them, or even if you're not making a living, I mean, it's your body. I mean, it's not my
Yeah.
body. Um, but I feel like if you're going to pay to come see me and you're paying, I need to give you stuff that I need to try to keep you alive as long as I can, regardless of what your behavior is going to be. So if you're open and honest with me, I'm always going to be open and honest with people. Yes, these compounds have risks. Here, tests we can do to hopefully mitigate the risk. Is this for sure going to keep you alive? Is this going to guarantee you have no problems? No, but it is better than nothing. And everything I do is, well, not everything, but I try to, as much as possible, to the extent that it's possible, base what I do on evidence and studies. I don't just make fucking videos where I talk about organic chemistry of how steroids are structured and then regurgitate bro science in a technical fashion to get people to think, ooh, this is like super useful. This doctor knows so much about steroids. Doctors don't know shit about the specific aesthetic or cosmetic effects of steroids. We don't, because why? There's no studies on that. It's presently deemed medically unacceptable to use synthetic androgens for anything other than specific medical purposes. And presently, cosmetic, aesthetic reasons are not considered appropriate medical reasons to use them. And as a result, universities, medical schools don't study it. Nonprofit organizations that fund research, in the NIH, and so we don't have studies like that. Should we? Yes, we should. And is it that's a whole nother discussion. Like, is it really even um acceptable to say that people can't use androgens for medical purposes? And I mean, it'd be better if you had a doctor who did know how to do it and do it in a way that's safer and could give you pharmaceutical grade stuff. But it's just ethically, we can't really do that now. So yeah, that's the state of things. It's sad, but yeah, if I had to give the average guy that's going to use steroids advice, is to try to get a doctor who knows about the risks. There's precious few of us out there. And try to treat some of these other influencers, even with MDs that talk about steroids. Take their advice and what they say with a grain of salt. If they're not talking about a risk reduction approach and they're just regurgitating shit that you read on Reddit or on bodybuilding forums, and even a lot of them sell supplements that they claim are, this is going to reduce your risk and stuff.
Yeah.
A lot of those guys are sharks. They don't have the best interests of the public at heart. I mean, I don't have a vendetta or any enemies amongst those types of people, but it is a fact that there's a lot of bad information, and some of the bad information comes from doctors. If they don't have studies and they don't have research that they can point to, chances are good they don't know what the fuck they're talking about.
Yeah, and I think a lot of times, like you said, like the influencers are just trying to they're just trying to sell something at the end of the day, right? So like whether that's they're selling a program, they're selling this, they're selling that. And like I'm in that same realm. So it's like, there's times where it's like I make a certain post and it's like, yeah, you're trying to attract an audience to that post, right? Like it's not always,
Right.
the most deep dive into a topic and obviously that's why I like having, someone like you to talk with because it's like you could actually get the real information behind something, not just the surface level information that people typically post online. And a lot of
Yeah.
people just know the surface level. They're like, oh, like Anavar, like what does Anavar do? And then it's like, oh, it does this, blah blah blah. But it's like, what are the real, behind the scenes? What's it going to do? How's it going to impact your cholesterol? How's it going to impact your heart health? How's it going to impact other things? And that's like things
Yeah.
where people don't discuss it at all. They're just like, oh, come off cycle, do a blast and cruise, you're fine, that's it. Like take a few health supplements, whatever, do your blood work, that's it. And I think it's
Right.
when you mentioned the aromatase inhibitors, that's another thing where it's like I feel like when I started competing as a bodybuilder, um, it wasn't as commonly abused as I feel like it is now. Because I feel like now people are like, they think estrogen, if your estrogen's too high, it's like the worst thing ever. And they're all worried about, oh, I want to look, presentable year round. So they think they have to keep their estrogen like super low in order to look a certain way all the time. And that's where you see guys,
Yeah.
where they're just always using an aromatase inhibitor, even if they're just using TRT, et cetera. And I even did that a few times back like when I was doing cycles and in between I would incorporate it. And then I realized I'm like, I don't really need to do this. Like, and then it wasn't even because of like what you mentioned. Like you obviously were able to break it down a lot more and explain that it's like obviously terrible for you to do it all the time. And I kind of just I
Yeah.
had stopped doing it, and then like later on, I started to like hear more people saying how long-term use and using it too much, blah blah blah, is going to lead to more health complications down the road, more so than just, using synthetic androgens on their own. So then
Yeah.
like me, knowing that now, I'm like, I'm glad I kind of did step away from incorporating it as much because it's, I see guys even now where it's like they're always taking something like aromasin just when they're using TRT. And I'm like, you don't need to do that. They're like, oh, well, my estrogen's out of a normal range. I'm like, so is your testosterone. It's not necessarily a bad thing. Unless you're getting, gynecomastia type side effects or something and really, really bad from it, I don't think you need to,
Well,
incorporate something like that necessarily.
yeah. I mean, if I had to say the biggest problem with the coaches of today that advise people on steroids and what to use is a lot of them confuse the presence of side effects and abnormal hormone numbers with proximate risk of death and other medical problems from steroids. Well, as
Mhm.
I said, when you're on steroids, your estrogen level is way down the list of what you have to worry about. Like way, 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 way down. The thing you have to worry about is your heart and your blood vessels, your kidneys and your liver. Anybody who tries to distract you or try to get you to look at your DHT or your DHEA sulfate or your estrone, your estradiol, all this other shit they don't know what they're talking about. If your goal is to live as long as possible despite using synthetic androgens, your heart, your blood vessels, your kidneys, your liver, and your brain, obviously, mood,
Mhm.
things like that. The numbers of hormones on a hormone panel is not it doesn't mean if your thing if this hormone's normal then I'm safe. It's just they're just an obsession with hormone levels being normal. That's not what kills people. What kills bodybuilders and people that use steroids is heart attacks, strokes, sudden cardiac death slash arrhythmias, and heart failure, and sometimes kidney failure, sometimes liver issues. All these things are interconnected, obviously, because if you have issues with your vascular system, that's going to affect your kidneys, which is going to affect your heart. So it's not like these are discrete issues, they're heavily interrelated, often in very complex ways. But it's not my hormones have to be in balance, but my testosterone can be astronomical. What matters 1,000 to 1,000,000 times more than your estrogen levels? What's your LDL cholesterol? What's your fucking blood pressure? I get so sick of even seeing doctors talk about, "Well, you need to control your estrogen." They don't talk about, like, what is your fucking blood pressure, man? What is your blood pressure? What's your ejection fraction? You know,
It's
what's your creatinine? They've lost focus. That's the problem with a lot of them. They shift into this bro science world where people who are not doctors get focused on things that are not important. And this also gets complicated by the fact that obviously if you're a bodybuilder, your physique matters, so to the extent that other hormone abnormalities make your physique less ideal for competitions or whatever. So I understand that complicates it, but this is where doctors have to be involved. We just have a hands-off type of attitude towards people that use steroids, and that is killing guys. That's killing guys to not have doctors involved in people that use synthetic androgens. We have to have doctors involved. People have to stop being scared of guys that use steroids. Guys that use steroids have to stop being scared of doctors. It has to be a two-way street. Okay,
Mhm.
it cannot be judgments about that. I have patients that make millions of dollars as a result of using steroids, and they don't have other skill. That's the thing. Like, and I don't mean this as an insult by any means, but the reality is they've been bodybuilders since they were fucking 16 years old. This is their skill. This is how they make their living. So it's not appropriate to tell someone like that, just stop using the steroids or I'm not going to take care of you. No, this is how they make their living. You have to meet people where they're at and help them as best you can. But unfortunately, doctors don't do that, and it's not as much of an added. I mean, in part, it's an attitude of, well, you're doing this to yourself, so kind of like fuck you. It's
Mhm.
far and away more the fact that like there's no guidelines on how to take care of people like this. There's guidelines for how to take care of people that, like I said, and I'm not saying that guys who use steroids are like guys that abuse heroin. I'm not comparing those two groups of people like they're psychodynamically the same. But taking another illegal drug, class of illegal drugs, that's not the attitude that medicine has towards people that abuse opioids or abuse methamphetamine. Unfortunately, there's just this attitude about guys that use steroids like, I don't know what to do with you, and you're kind of like choosing to do this to yourself, so fuck off. you know. But yeah, but I hope that changes, and I've tried to change that. I like I said, I've had the primary care of patients with complex androgen use history. I've some of these influencers that are doctors, they can't contribute or don't want to contribute. Um, they just, like I said, a lot of them are just out to make money and get
Mhm.
views. And presently, sadly, and I could be wrong about this, there could be other people on social media, and I hope that I meet these people, but that are focused on the risk reduction aspects. But presently, I don't know of anybody that does that is so. But hopefully, in the coming years, we'll change that.
No, I agree. I think it is something that definitely needs to change. Because when it comes to like people who are doing this for a living, they should be, they should feel comfortable to have a doctor that they can, approach with this type of thing so that they feel confident that they can, not necessarily, what they're doing is healthy, but they can do it in a healthier manner or
Yeah.
mitigate the risks better. So I'm
Yep.
assuming like, I was going to ask you in regards to like, what do you think would be the biggest risk or sorry, biggest mistake you see like enhanced athletes make when it comes to using synthetic compounds like the androgens. But I would assume you would say probably the biggest mistake is not having the medical supervision involved. So
Yeah.
that
That
one's
is
kind of
because that encompasses everything. If we have research, this is again, I hate it's going to seem like when people watch this that I came on here with the agenda of bashing other doctors who are like big influencers. But I have to say this again. Doctors can help people, okay? Especially
Yep.
if you're doing something that is risky. We have studies on what kills bodybuilders. We know what to look for. We have tests that we can run on people to see when problems are starting to arise. Are they perfect? No. Are they widely available? In a lot of cases, no. But do we have them? Yes. So they exist. And there are grades of risk reduction too, right? So, for example, one thing that I have seen, even like rich guys that use steroids do, fuck doctors. I'm just going to check my own blood work. Well, I mean, okay. That's better than, I guess, not getting any blood work. But it's not. It's better only if you actually know how to interpret the blood work. If all you're
Mhm.
concerned about on the blood work is that, oh, my creatinine is the same as it was last time, my liver enzymes are the same as what it was last time, but then now I'm going to focus on giving myself a bunch of other drugs to make sure my hormone levels, which don't matter, um, need to be normal and stuff like that. It can lead you astray. Medical tests in the hands of non-experts can lead people to do more damage to themselves. So when I say there are grades of risk reduction, yeah, even having your blood work checked, eh, that's not like universally a good thing unless you know what to do with the tests. And what you do with the test is actually going to help keep you alive. Um, so that those are the big things and pitfalls people fall into is thinking that they can be a substitute for a medical professional is a huge mistake. It really is. And unfortunately, there are a lot of guys, even with the means to get good medical care, that just don't do it because they think, and it's not all their fault. They have this idea that the doctor's just can tell me to fuck off. So, um, and that is, I mean, that might be true in their case, but now we have people that actually, you know, me, for example, um, it's non-judgmental, but we can help you through it. But yeah, the other grades are, yeah, getting echoes, and even just getting an echo from your primary care doctor would be useful every year, even if it's just a regular echocardiogram. Hey, tell your doctor, hey, I use steroids. This is how I make my living, or don't justify. You don't need a justification. You just tell
Yeah.
them I have been using anabolic androgenic steroids. This affects my heart. Would you please order an echocardiogram? That that's going to be read by a cardiologist. At least then you know your ejection fraction's normal, or if it's abnormal, it's probably time to stop using them. That's better than not knowing. Checking your blood pressure is better than not knowing what your blood pressure is. Taking blood pressure medications in the way that I said to lower the risk potentially is also a grade of risk reduction. So doing nothing is not acceptable. But a lot of people aren't going to get like what you would get at my clinic, which is like every test and, you know, regular spaced intervals and interpreted by people with a lot of experience with people who use androgens. You may not get that level of risk reduction. But in the middle of that, just having a primary care doctor that can prescribe you blood pressure medicines and who can order an echocardiogram. I mean, that's going to be way closer to this side of safety than the do nothing side of safety. That could even save your life in a lot of cases too. Because you imagine you have an echocardiogram, you're a guy that's used steroids for years. If your ejection fraction's 46%, that's useful to know. Okay, time for me to do something else. That's better than you staying on it another year and not knowing, and now all of a sudden you have heart failure with reduced ejection fraction, which has a 5-year mortality rate, I think last I checked, of 70%.
Yeah.
So that's good if you can get that. And if you have a primary care doctor, even nurse practitioner, PA, I don't know that they have those in Canada, but that can be better than nothing. But don't be comforted by the fact that your labs are normal. That's another thing I want people to understand.
I think that's a big takeaway from today is like, you need to go outside of what the traditional blood work and do more tests and make sure
Yeah.
that you have, the proper guidance from, a doctor and like being able to, try and do some, I think people should just do whatever research you need to do to, find a doctor, even if it's like a virtual type setting where you just do like virtual appointments, whatever. If you have to like outsource that far, because I think
Yep.
the biggest takeaway, in my opinion, is yeah, like making sure you have that proper relationship with a doctor so you can oversee like mitigating the risks with your health and doing things properly, because I feel like a lot of people, and like you said, a lot of people are just like, oh no, I'm fine. Like I feel
Yeah.
fine, my regular blood work's fine, whatever. So they don't really dive into these other things until they start to feel or see some issues come up, whatever. So I think, yeah, that's the biggest thing is just like doing it right from the start and then you know, not taking the path of like, oh, I'll just do it and then worry about it later, because I think a lot of
Right.
people do that. And, it's because whether they
Yeah.
either think the doctors don't care or they think that they don't need to worry about the risks is like, they're generally healthy or they feel generally healthy. So
Yep.
in the long term though, yeah, that's definitely the smartest approach. And I know there are some doctors out there that are more like you where they can actually help give people, the proper guidance, the proper tests they should do, the proper approach they should do, whether it's medications, etc.
Mhm.
As compared to doctors that'll just tell them to stand like kind of like just be standoff and be like, no, I'm not going to touch this. So I think
Yeah.
that's something that's becoming more commonplace. Like there's not as many as we need, but at least there are people at least there are doctors that people can go to. And I think that becoming more of a something that should be publicized more mainstream on social media, that people talk about as opposed to just talking about taking this compound or doing this or etc. It's like they should be kind of, pointing people in the right direction towards this is what you should be doing, to mitigate risks, reach out to this
Hmm.
professional, people like this, etc. So that way people have the proper guidance in the whole scheme of things, not just using this compound is good for this or using this compound is good for that. Because like,
Yeah,
that's really not what most
that's
people
not
need.
useful. I mean,
Yeah, it's
yeah,
what they want to hear a lot of times because they want to know what something does, but at the same time, it's like you need to know the ins and outs of everything involved in that, not just what that compound you're taking is going to do for you, like physically in
yep,
regards to, your body composition or strength or whatever.
true. I agree with all that. Hopefully, we'll start to bridge the gap. I know by the end of summer, I have a healthcare providers course that I'm releasing that's more TRT focused, but it is going to have the basics of caring for men on synthetic androgens. Um, it is hard though. I'll be honest with you. I was on my live stream the other day and I was sharing, getting involved with talking about steroids, even though I've never prescribed anything other than testosterone ever. And I've never advocated that people use androgens for any purposes non-medically. I've always said not to do that. I've always talked about the dangers of it. Even just doing that has cost me very dearly professionally. I've lost a lot of money. I've had reputation issues. And I have people that have called my office and left angry messages, like moms who, oh, my son abused steroids 20 years ago. Now he's dead. Fuck you. How dare you talk about steroids at all? And I will tell them,
Right.
well, I'm not telling people to use steroids. I'm trying to reduce their risk, despite the fact they're going to use it. Well, you shouldn't even talk about it. You're immoral for even talking about it. Um,
Wow.
and I have other doctors say things along that have come up to me and told me similar things along the same lines. Get rid of all that steroid stuff on your social media. This is a public relations nightmare. So yeah, it's frustrating for me, even though I've done that, thousands at this point, thousands of hours of research into it, developed my own guidelines. I've tried to release things to help people. It's been, if I could go back and knew what would happen if I went down this road, I wouldn't have went down it. At this point, the reason I persist is just because I don't like people telling me what I can and can't do. I'm very resistant to that, but it is
I
kind of
also
an area that people don't appreciate. And people even, a lot of moms out there have very strong opinions, even though it's none of their fucking business, and try to ruin your life and ruin your professional reputation just for even talking about it. Doctors shouldn't talk about steroids at all. They have no business talking about it. That's the attitude of a large percentage of people in society. Somehow they don't have those same attitudes about plastic surgeons that do questionable cosmetic procedures on young women who want to improve themselves cosmetically. And I'm saying that not because I have a problem with plastic surgeons. I don't, at all. But it's just interesting how something that historically has been deemed morally unacceptable is something that like is a 98% plus male involved activity for aesthetic purposes. Somehow that's immoral and that's wrong. And no doctor should be involved in that. But oh, it's okay. Anything women want to do is perfectly fine. So it just shows you how our society's attitude is towards men. And you could argue that men who use androgens, I mean, there's all kinds of data and the social sciences about men care about how they look and about their physique in many cases just as much as women do. And
Mhm.
how men look is, that is closely tied into their sense of well-being, their sense of agency, and also just the realistic acceptance of the fact that regardless of what you say or what I say, the guys are going to use the compounds. It
100%.
doesn't matter what mainstream medicine thinks about it. These compounds are going to be used. They're going to be used. does not matter what moms, these social groups for parents with, low IQ idiot children who killed themselves with steroids. I mean, I'll just say it how it is. Don't take the don't put on me the don't take your wrath and all the anger you have at your stupid kid who killed himself with steroids. Don't take that out on me, because I didn't tell him to take steroids. I didn't tell him it was safe to take steroids. I have consistently and always said it is unsafe. And I've only talked about reducing risk if you're going to use them and things like that. But I have never in my career, at any point in time in my life, ever told people you should consider using steroids. It never happened, never will happen. But I even just doing that is has resulted in a lot of blowback. So that's the other thing people need to understand. That's why doctors don't want to even go down this road in a lot of cases, because there's a huge stigma attached to it. And the people that are very anti-steroid are extremely vocal and extremely active, and they will try to ruin your life even just for talking about it.
It's really unfortunate because, like you mentioned with the plastic surgery, it's like something like that is socially acceptable and steroids isn't socially acceptable. And it's one of those things that everybody always just has a bad impression of because they're not properly educated on, what it does. And obviously there's risks involved, like, and that's something that should be made known. But it's unfortunate that like these people and, and parents and other people like have such a negative reaction to what you're doing when in reality, what you're doing is actually like almost like a breakthrough into the right direction of what people really need to know and need to be doing. And
Mm-hmm.
it's like you said, it's like steroids is something where people are going to incorporate it. Like there's athletes of, whether they're bodybuilders or they're involved in other sports where it's going to be utilized because, whether it's performance based or aesthetics based, like people are gonna do them either way. So it's like, why wouldn't it be a good
Yep.
idea to make sure everybody's properly educated and properly having the medical guidance and everything else in between? And I think if anything, like people should be like encouraging that research and encouraging that, direction of things going in that way as opposed to the other way. It's kind of like when they've legalized things like, marijuana. It's like, before it was legalized, they're all like, oh no, like it's
Yeah.
terrible, it's terrible. Now that it's legal in, multiple states and countries like Canada, it's like, people look at it like, oh no, it's great, it's a miracle like substance, blah blah blah. And I feel like with
Yeah.
steroids, if they
Nobody's ever has a moderate position anymore. It's always an extreme to one
yeah.
side or the other. And you're right about that.
No, exactly. And I feel like with synthetic androgens and steroids in general, I feel like people, if things go in this direction, like that you're trying to continue to make things go in and it becomes more of a mainstream topic for people to approach it in this way, then I think it would become a little more socially acceptable for people to, talk about it and not have such an extreme view in either direction, like whether it's like, oh,
Yeah.
this is so great or this is so negative. It's like, no, this is what can be done, in regards to what
Hmm.
results can happen from it. But this is also the side effects. This is what you need to do medically, to try and prevent side effects, having, with a doctor, etc. And I feel like that would be the best case scenario, and I hope that's the
Yeah.
direction that things continue to go in. And, I think what you're doing is amazing. And, I wish more people would be more supportive, but I'm glad you've kind of like stuck it out and been able to continue to do your thing because there's definitely people, in the bodybuilding world that appreciate that. And I think in other sports as
Yeah.
well where they use enhancements. So I think that
Yeah.
direction is very important for people to, be able to follow.
Yeah. I mean, the thing about the average guy, particularly competitive bodybuilder and power lifters and things like that, is these are like my types of people. So at this point in time, it's a mixture of I don't like people telling me what to do. My instinct when people tell me I can't do something is to fucking do it anyway, because
Yeah.
I don't like being controlled. But it's also like these are my types of people. I want to take care of them and I want to be there for them, especially because there's nobody else that is. All these famous doctors, they don't have it. in almost every case, they don't have anybody's best interests at heart. They're just trying to fleece people and make money off their supplements, peptides, and educational courses and other bullshit. So I'm gonna do what I can. But yeah, I mean, it is a minefield for sure. So it's I don't want to pretend like it's the end of the world and like it's the most dangerous thing to do, but professionally, it is a reputation damaging area to get involved
Yeah.
in, and especially when you're at the forefront, you know.
Yeah. I
But
think,
yeah, I do have lots of doctors that are very supportive. That's the other thing people need to understand. Like, especially primary care doctors, endocrinologists, these are not like bad people. These are not people that are paid by pharmaceutical companies. Like in 99.9% of cases, they just like they want to help people and they want to keep people safe. They're very well intentioned. They just either don't know how to do it or it's very like risky to do it. And so
yeah.
and you add in the complexities of the US healthcare system where they see like 40 people a day, they have like 5 minutes with each patient. Like it's just very, very, very difficult, even with the most well-intentioned doctor, to get good risk reduction care if you use synthetic androgens. It's very, very difficult. Hopefully, we start to see that change. I'm going to do my part to hopefully see that change, but I don't have any help, is the other thing. So, people got to be patient and hopefully it will change over time. And I know my patients are very happy and
Mhm.
that we've done things that I think have saved people's lives, detecting early changes in the heart and getting, like I said, at this point, there are guys out there that use it that really they needed to retire 2 or 3 years ago. And if they knew the extent of damage that they've caused, they would have retired by now, but they don't because they're listening to, and again, I don't say this because I have particular vendetta against anyone, but they're listening to Instagram coaches who say your labs are normal, you're fine, just keep doing what you're doing. But that's the consequence of doctors removing themselves from the space completely, and hopefully we can start to change that.
Yeah. No, I totally agree. And I hope there's, more doctors like you, in the near future, like going in this direction and, being able to help people like this because I think it's much needed. Um,
Yeah,
so, I just want to, be able to thank you for coming on again today.
yeah,
Uh, we
appreciate it.
definitely, we definitely
I hope it
were,
was useful.
yeah, no, we definitely got a lot of good information in there. Like I know it's going to be another great episode, and I think this one will be even more interesting for people because everybody wants to hear more about the deep dive into things surrounding synthetic androgens more than just TRT because
Yep,
especially the young people, they want to learn about these things more. So it'd be good for them to hear this from you and to understand, more so the side of like risk prevention, what they should be doing on a more, consistent basis as opposed to like what the basics of what people are, kind of voicing that they should do. So it's giving people more
yep,
in-depth insights, and I think that's the biggest thing.
useful. Yeah, I hope so. Well, thanks for having me. Appreciate it. We'll do it again
Yeah, of
sometime.
course. We'll definitely have to line up another one. I'll think of another kind of like another topic we can discuss because there's definitely more things we can dive deeper into. We've kind of just done like a general overview of things. But yeah,
Sure.
I think we should keep this going because I think the audience, combined audience of what you have and what I have, it'll reach more people that way too, and they'll be able to get more of what they need to know about this area when it comes to, using any type of performance enhancing drugs.
Agreed. Well, yeah, man, my pleasure. Good seeing you. Good talking to you.
Yeah, man, you as well. Just
All
gonna
right.
pause the stream.